The Health Secretary, Jeremy Hunt, has been dealt a humiliating blow by the Court of Appeal, who ruled that he did not have the power to implement cuts at Lewisham Hospital in southeast London. It follows a High Court ruling in the summer, which also ruled that Mr. Hunt acted outside his powers when he decided to cut back emergency and maternity units at the Solvent Hospital. Local campaigners celebrating outside the High Court today said the ruling would send a message to the government that they couldn't ride roughshod over the needs of the people. They argued that the community was being made to pay for the £150 million debts at a neighbouring NHS trust. It's the second time in 3 months that courts have rejected the government plan. It'll raise serious questions about the government's ability to reconfigure local services, a concern addressed by Mr. Hunt. He said the government may now look at amending the law enabling the NHS to change and innovate in future. The point of principle could hardly be clearer. Should the Health Secretary have the right to order the closure of English hospitals? Well, with me is GP Louise Irvine, who campaigned to keep the hospital open and therefore welcomes today's decision, and Nick Samuels from the Foundation Trust Network, who are in favour of seeing a shake-up of NHS services. Welcome to you both. Let me start with you, Nick Samuels. This is pretty humiliating, isn't it, for Jeremy Hunt?
This is about the ability of the NHS to make changes that it's fit for the future. At the moment, we've got a service configuration which is based on how the NHS needed to respond to people's needs 50 years ago. We're now looking at what comes in the next 10, 20, 30 years. And from today, it's very clear that we do not have the means necessary to make decisions about what the future of care should look like.
But why punish a hospital that is doing really well and is solvent? Because that's effectively what this would have done.
Even the best performing hospitals need to change to stay the best performing hospitals. And what today's ruling...
do they need to shrink?
What today's ruling is about is that you can't make a decision about the needs of local people on a hospital by hospital and a service by service basis. And what the government now will be looking at is how do they make changes for whole areas and populations of people rather than individual hospitals. Because an individual organisation is tied into the system, and you need to look at what's going on in the system with GPs, with hospitals, with community services.
Well, let me put that point to you, Louise Irvine. No hospital is an island, even if it's doing very well. The government has to have the ability to make national policy for the National Health Service, especially when it faces a fiscal cliff.
Well, this legislation was designed to actually rush through decisions for emergency situations with a trust that was in severe difficulties. So it was going to use draconian powers to make changes for that trust. They were trying to use that legislation to make general reconfigurations. Now, there's nothing wrong with thinking about change, because change has always happened, but this is the wrong legislation to do it with.
But surely the principle is that you, as a government, you have to be able to make national policy, and you can't just adopt a policy of not in my backyard, which is what you're doing.
Not at all, but the government has actually said that local people and local clinicians should have a big say in local health services. And as a GP, I can say that all the GPs in Lewisham and the hospital doctors and nurses and the people and the council were against this change. Now, the government has already said that it supports local involvement. This legislation rides roughshod over that local, those views and opinions, and therefore it's the wrong legislation to use for any kind of real change.
Nick Samuels, did the Secretary of State just choose the wrong hospital? This is a question of bad political leadership, and having failed twice in the courts, it's particularly humiliating.
I think we have an issue as how do we make change in the NHS? What are the processes that we can use? Evidently today, that process hasn't worked.
But you've got to pick the right hospitals, aren't you, if you're going to cut?
You've got to pick the right environment to make those changes in. You've got to involve local communities, and the Lewisham campaign has made its case very effectively that we have not involved local communities effectively to make the changes that people think are necessary. But we are facing a situation whereby most people acknowledge that change needs to happen, that the way we have hospital services and the NHS organised isn't fit for the long term. We don't have the money to take things forward. We have the same pot of money which we need to provide new and different services for, and therefore things will need to be organised differently.
But what you're telling us is basically management gobbledygook. It's management speak, and we're talking about people's lives. People who are used to going to their local hospital, the hospital that has treated them and their families well over years.
In London, we made major changes in the last few years to how you treat stroke and trauma. We concentrated into specialist centres from 24 hospitals into 8 specialist centres. Everyone agreed with that. It has saved hundreds of lives since it's happened, and yet it took 3 years with everyone agreeing for that to happen. So even where change is agreed, it took us 3 years where lives could have been saved, and we didn't do that because of the processes we have to make change.
Louise Irvine, would you accept that the National Health Service faces a national problem?
It's the most one of the most cost-effective services in the world. There's a lot of wastage. I don't think the problem should be about closing vital local services. There's ways of looking at money and how it could be spent better.
But if you have set a precedent with this successful protest action, is that not going to be difficult down the road for introducing the kinds of reforms that even you would agree are necessary?
Well, first of all, I disagree with the plan to close possibly up to a third of London hospitals and many hospitals across England. I don't think there's any evidence that you don't need a good district general hospital. The idea that 3% of emergency admissions, strokes and heart attacks and major trauma can be treated in big centres. You cannot extrapolate from that to all the other conditions for which people get admitted to hospital, where actually being closer is better, like meningitis or acute asthma, that kind of thing. There's no clinical evidence to close the District General Hospital, and they have not made the case, and that's why the government's trying to rush through things. It's not prepared to make the good clinical case for its plans. Now, changing things is all very well, and that's good, but it has to be done in a measured, gradual way with proper investment, and it shouldn't be premised on closing hospitals.
I'm afraid I have to leave it there. We run out of time. Louise Irvine, Nick Samuels, thank you very much indeed.